You said, "No, I want to hear my lecture."
Yes, sir.
So take a seat there.
Sir, actually she has 1 hour class now, so
After that you can come. Come by your comfort. I just said you can sit.
Sure, sure. I'll sir.
And I'll give you a certificate of attendance.
No, sir, I will learn first, then you give.
A mother who really wants to recover his child is the best student.
I need to learn first.
That's what I said. A mother who really wants to recover a child is the best student.
Yeah, I have ready client.
Not ready. But a crazy client. You're crazy to recover him. A mother who has struggled for 7 years. Babu, power bank चाहिए.
It's okay, Pari. Strong bacha. Strong, very strong. It's okay. Strong. So thank you.
See, by subcutaneous needling, can you ever believe that these people can recover? In which book of medical science it is written? We have to see 5,000 years, 10,000 years back, they used to do it. In our Shastras, Yatharva Ved, it is written as Suchi Vedana. The recovery of a patient is in the body itself. You have to just trigger the recovery and open some pathways, that's all. You don't need to give what? A body full of chemicals. Better get a chair. Tell the, is one of my oldest friends who have seen me in my Vedanta hospital. When I established Vedanta hospital, he saw me there. We were building it 200 builded, and on the day of Diwali I left it. See, that's the finest part of we physicians. We create and we leave. He has created many things in many hospitals. He became HOD of orthopedics in many hospitals. And suddenly he felt, I should leave. Because he realized the vision of Captain Gopinath. What was the vision of Gopinath? That airlines industry is going to doom. Before he becomes doomed, he thrown it into Kingfisher. Kingfisher took it and doomed himself. Why have so many physicians, patients? Only because of one reason. They don't want to be operated. Yes, because people don't want to be operated because they have created complications after surgery and we have no solution for complications. We have solution for infectious disease, but for deficits and other problems, we have no solution. Orthopedic surgery can be only successful when it has a successful rehabilitation program. Rehabilitation can be only successful when it has a successful orthopedician with it. Yes. I have grown hospitals in my life. Even you knew I have grown Vedanta hospital from scratch with nothing to some level. And then one day I left it. And then again I established hospital. The moment I came here, the documentation is in process, but my work is not yet in process. Because people come in inspection, they want to see I have things or not, right? So purchase and keep it in such a way that they don't question you, right? This is what the brain says. This is that whether we have proper facilities or not, we are right person or not. If you are right, no one can catch my collar. But if I am wrong, everyone will catch my collar. I have more than 250,000 videos in Facebook to prove I am correct. There was a court case where my statement was to be noted. Can a person die with cardiac arrest while putting electroacupuncture? I just said, sir, let us first determine what is the connection between the heart attack and the acupuncture. Let the board decide first. Because board was very negative. Whole country was negative because of one or two people who were quacks. Then I realized everywhere there is acupuncture teacher. Make it more simple. Make it dry needling process. Now you are away from the politics of what? Acupuncture. Where you have to prick the needle, you know. Right? Where to prick the needle, you know. How to prick the needle, you know. Correct? Why unnecessary to use the word acupuncture and create politics for you? This is what I have learned from American culture. They become acupuncturists in 5 days. How? By doing a dry needling course. And they come to us. They learn. On the other way, in America, to become a licensed acupuncturist, you have to spend 1 crore rupees in the school, and then you have to go through a stringent process of licensing. Hardly people pass, and then go and become acupuncturists. So, my way was very simple. Last time people created your politics. People come here not to learn. They come here to create trouble. I'm happy this time one giant is sitting. So when elephant sits or a tiger sits, it's a lion. No one roars. One is neuro, one is anesthesia, one is ortho. Now I think no one has the capacity to roar. And no one has the capacity to question also. Because we all three are sitting. And we are all three people. Mohan Singh, me, Saab, the orthopedic surgeon. Guess what? Competent practitioners. We have practiced and now we realize next world is not surgery. It's a world of integrative medicine. But in integrative medicines, failures are much higher. Because you go for slow process of recovery. And people want table bed recovery. You understood? Yes, world has changed. We are going to 5G. We are going to 6G. Your communication level should be so high that they will not come to your clinic also because they will have a consultancy with American doctor. And they will come with a prescription from America. You have to face that trouble. So your skills should be so higher that tomorrow a physiotherapy center is coming with robotics, this. And your skills should be so fine. Let him be frustrated from all this center. And you prick one needle, touch the pen, and he started walking. And then he will say, Sab phaltu hai. All the patients who came from Institute of this Spine Injury Center, they came and said here, we did the biggest mistake of our life. We finished our money before coming here. The biggest magic of your life, what you can see is what? The recovery of the patient. But don't think that the patient will fully recover, because he does not want to recover. Even if I tell them, I told one patient of spinal cord injury, sir has come, I am there, team is here. We'll give you 5 days free food, free stay. You stay and get 5 days treated so that you get at least some more improvement. All his injections and all, we made free. And he's saying, no, I want to go. They may find some trouble. But then I said, I'm going to make it free for 5 days. So 2 things you must understand. Don't see the end results of your... Don't predict. Start seeing the end results that you will see him walking in his life. Come inside, beta. When you want to attend, sit somewhere and attend. Don't see the end results. You should see what? Our problem. Why did not we recover the patients? Tell me, why, as a physiotherapist, why you could not recover the patient of neuro patients? Orthopedic knee replacement was only unsuccessful because they lost the strength of quadriceps. And because of losing strength and a lack of knowledge of rehabilitation in you, right? You entered the field, you attended so many seminars, but what did you learn? On demos. Here what I did, I created a center of patients where you can see the real recovery, real everything. You can see the MRI and you can see the recovery. First patient wants is management. Treatment which includes his management. Then he can be converted to surgery. You have a severe pain and then you say him, I give you painkiller and total knee replacement. He will never come to you. You put stones. Yeah, everyone is doing this. What is the difference between your practice and anyone's practice? In these days, we'll practice what? There are 2 parts in my practice. Those who want to buy the pen, which has been manufactured with the help of IITians and DRDO scientists to stimulate the brain, which I call it, which is my specialization of work, is NIBS, non-invasive brain stimulation. Earlier I used to use so many needles here, do this, do that, get a lot of trauma in the scalp region. Now, I want recovery in what? 1 or 2 needles. Can I change the morphology of the brain with subcutaneous needling? I think yes, I can change. उनको पता ना रेस्टोरेंट में मैंने वो मांगा है पावर बैंक. And whenever you people go, always go with one power bank at least. Just a power bank. Recovery can come to a patient only when series of procedures are adopted by knowing what is the series of pathologies. There are 25 reasons of pain. You treated only 2. Rest 23 will trigger pain. You cannot give up your ego because it was developed in years. But because of your own egoistic practice, what has happened? People have lost life and people have lost their interest in practice. You also have lost, patient has also lost. One spinal cord injury patient comes and a physiotherapist says, ये मेरे बच्चे का ग्रेजुएशन करा के जाएगा. He'll pay the fees of my son's graduation. And you will see, and what he will say, it's a joke. Don't take it seriously. He passed class 14. Just before graduation, he died. On his death, on the day of his death, he said, परसों मर जाता यार, आज तो फीस भर्ती हो जाती. When I spoke to Mumbai, that they said, what is the only difference between your thought and my thought? Whenever I see the cost is going high, the Woodland Hospital said, my room rent is 3,000. I said, per month is becoming 1 lakh. My patient cannot afford. I created this center in 10 days. There was the politics in previous center. Right? In the Sapphire building. We left that building. In how many days, 8-9 days. We found this building, nothing was there. I told Satish, walk day and night. All this was open. Close the door, put the windows. We never thought we'll convert this into a OT room. Suddenly I said, when his name came to, the moment I said, a orthopedic surgeon is coming. Convert it into a OT room. We don't need to cut. We don't need scalpel. But without scalpel, under C-arm, what we are doing, you can see. We bought C-arm not for ourselves. You close my eyes, I can give a epidural. Every day I give. And you see the results before and after. You ask me to put needle. I put the needle and the patient recovers. Just give me one needle. My patient, I have to put the needle.
എന്താടി ചക്കര ഞാനിവിടെ പ്രൊസീജിയർ റൂമിൽ
My only thing to say you is what? Don't create complication and give it to us. You understood? आप कोई भी केस को और कॉम्प्लिकेटेड करके मुझे मत दो. जिस अवस्था में उस अवस्था में दो. We'll recover it to a good extent. Because you don't have a setup. You don't have a team. Here we have a team of critical anesthesiologists. But the counseling should be that if you have time, then only come to me. Right? अगर आपके पास 2-3 महीना है, then only come to me. Otherwise, I am what? Useless. Our part is divided into 3 parts. Acupuncture, dry needling, and non-invasive brain stimulation. My expertise is in brain stimulation because without brain stimulation, I am nothing. I have stopped forgetting putting needles also earlier. I used to recover people with my fingertips. Like this. But then it was only improving my expertise. It was not improving the expertise and recovery of the patient. And people took me what? A miraculous Baba. Rather than a physician, I became a Babaji. 80% of the people call me Guruji. Only few call me Dr. Sastri. Ha, Guruji. You know why? Because I have learned certain procedures by which people can get recovery. Our problem is what? The new generation which has come does not want to learn and grow. The new, not you. You people still want to close your clinic, face the financial loss, and upgrade yourselves. But this upgradation should not stop in just 5 days. Don't run after money. Money will run after you. All those people who have run after money became Anil Ambani. There are 2 brothers, Anil Ambani and Ma. And those who all followed the vision of his father, he became Mk Ambani. How can you become rich? By making things cheaper and easier. If you can reach a common man, you become what?
न्यूरोलॉजी
हाँ उनको लेके आना और 5 minutes में लेके आना. So I'll show you how I have recovered patients of trigeminal neuralgia with one dry needle in one session. 80% pain gone, and I immediately gave him to eat guava. That old man video has been seen by you in the Facebook. He has been taking Tegretol, carbamazepine and other medicines. For how many years? 5 years. And I recovered him in what? One needle. His wife is having great for osteoarthritis, severe pain. But she is able to reduce her pain in just 4 days by 80%. My advice to you is, we are waiting for you because there is a grade for osteoarthritis. Knee is fused on one side. I have recovered that patient by 80% in 3 or 4 days. That patient is over here. We have a patient from Vellore who has been treated 11 years from Vellore and they could not reduce much of his pain, and I have reduced 80% of his pain. He is suffering from connective tissue disease. And now our 80% of the pain is gone. She is over there. I will teach you only for 2-3 hours and our theory is over. We'll focus fully on practicals because slides, this is not required. Now, a decision has to be taken by yourself. What you want to be. For example, when I saw Dr. Manavani, I said we can build an excellent team both in Mumbai and Hyderabad.
Yes.
Right? We may take a small time, but we both can build an excellent team. Why? We want the best stroke clinic in the world. We want to analyze CTs also. We want to study MRIs also. And the best part of my life was what you know. I reduced my expenditure from lakhs to 2,000 rupees per month. And now I'm a happy man. You are unhappy because your demands are not fulfilled. I have no demands. So my requirement is what? Nothing. So those who are thinking, those who want to learn what the neuroplasticity and dynamicity of they have to go with tools. And those who don't want to learn, they can leave the class after 6 p.m. and enjoy Hyderabad. Go to Charminar and all. Go to pub and take some alcohol. And those who want to learn about the neuroplasticity of the brain, how by putting supposition in the ending and stimulating it, you recover a disease, they can come to me and what?
Get knowledge.
Get expertised. I tell you, my students are doing excellent. One is William. He was a railway vendor. He was a vendor in a railway. He's an orphan. But today he is earning 4 lakh rupees in Nepal, Indian currency. He's treating cancer patients and he's saying, you see the results and then you talk to me. How did I teach him, you know? I did not understand this language, what he is speaking. But he used to take care of me when I was very sick here and no one was there with me. So he used to give me bath and he used to put oil on my leg. During when he used to put the oil on my leg, I used to mark the points, and I used to say, use this, and I used to write the name of the disease. And a diary became. And today, when he recovered a patient, an old man who could not walk for 5 years, inserted few needles and he started walking. He placed his video and he immediately got a job of 3 to 4 lakh rupees in Nepal with a BMS doctor. Indian currency. Rajesh, Rahul, whose name you know, they were all Sujok practitioners. But today, being a physiotherapist, forget they don't do any physiotherapy. You ask them to do exercise. Rajesh used to do, and he got a cardiac arrest. Because body does not need too much exercise. Pulling and pushing is not the contraction and relaxation of muscles. What brain needs is impulse. It's the same impulse which you can create from mouth, and it's the same impulse which you can create from what? Needles. How to place them properly? Instead of going neuroanatomically, let us go holography-wise. First go to your clinic, prove yourself you can do something. Prove here you can do something. Today I will teach you, tomorrow you practice. Yes. My theory is finished in 5-10 minutes. I don't have very big things to teach. Because patients are your best teacher. But remember one thing, what I teach I don't practice, and what I practice I don't teach. So those people who can afford to buy the pen, you have two categories. One is good quality, which has a 5,000 to 6,000 or 7,000 difference from the major quality. This set is required because these muscles are connected with what? Impulses of emotions. You know why after surgery people cannot walk knee replacement? Sir, can you tell me one reason?
First is imbalance in the ligament. Second reason may be implant failure. Third reason may be infection. Fourth reason may be improper switching of muscles leading to
You are right, sir. Most important part they lose is compensative muscle pattern, which they have developed in years. Once you do knee replacement, they forget to take the body forgets to take the compensation, and they progressively degenerate because of this. Why? Because of the discompression, enough compression in the spine.
often patients, almost all patients complain of back pain.
And how do we treat back pain? With discectomy, microdiscectomy. While 80% of the patient can be managed without surgery.
Without 99% can be managed without surgery.
I believe 80 to 90% because I work with the field of neurosurgery.
Yeah.
So I always believe 20% should still get the scope for what? Neurosurgery. 80% should get the scope of this. And now I believe, why don't we integrate neurosurgery with rehabilitative procedures? So we took out a procedure of called rehabilitative medicine. गणेश अंदर आ जाओ बेटा, तुम बाहर अच्छा नहीं लगता, तो बहुत एसी चला दो. वो पीछे वाला रूम लॉक कर दो बेटा.
डोर लॉक करो, डोर लॉक
वो फैन चला दो, हवा सर्कुलेट होगा।
आपको ब्रेकफास्ट रेडी।
ठीक है, खा लेंगे, क्या बड़ी बात है। रोज तो 12-1 बजे खाते हैं, आज ही 12-1 बजे हो जाए, कुछ काम की बात हो जाए। So the clinic is divided into 2 parts. Those who are interested to work with neuro cases, neuro recovery, they can attend the night classes. But they have to buy the pen because without tool. I just laughed with one of my friend. He said me, "Sir, give me a Botox pen." I was just amazed to see. What are you speaking? Being a physician, you do not know. The spasticity is a lesion in the motor neurons. You have to go by series of procedures. Otherwise, the patient who is on the bed will be continue to be on the bed. And this is a strong pile up of cases which says that it is a $1 billion market. You see, in 6 months I have done so many things. In next 6 months, what I am going to do? I have started giving fellowship from Institute of Neurosciences, right? But combine these credits, right? Go and give your exam in a university and make it a MSc degree. But if I go and talk to them, today what they are asking is huge money. What they are asking? They are asking 3 to 4 lakh rupees for your degree, which I taught. And what did I say? I am going not to pay more than 10 to 15,000 rupees. It is only possible when you have what?
Dedication.
Group. I have 400 people to be felicitated. You want this 400 people, credit of 400 people or not? Yes or no? This much money I am going to give. Yes or
No.
no? No? Fine. I'll go to others. I'm going to integrate this degree with Malaysian University. One of the president of a Malaysian university is my very good friend, Lincoln. But they are, money-wise, they are very poor. But one of the university which has opened here is Vishwakarma University. Right. That is why I said you have to divide your routine, you have to create a planning in your clinic. First learn the fundamentals. Your clinic should not be disturbed. You should train your juniors. As well as we should have time to attend what? Places like Karat, where Ipicerian is there. Attend with him his ICU rounds. Come here and recover the patients. Spend here sometimes. Refer some patients here. Counsel them properly. Give them videos. Instead of putting them whole life on bed, why don't we divide our work into 2 parts? Like what I did with our brother. She said our brother will not recover. I gave her lecture on that. My mother died. It was the 5th day. I was not even in the mood to talk to the people. But then I gathered my inner strength. Because at that time, my mood was to close down the center. Because of the politics of that center. But when I saw a brother, he was suffering from non-comprehensive myelopathy. She is a professor of dentistry. Only those people will come to me really who are victims. Transverse myelitis and what? Multiple sclerosis. Infectious, autoimmune and demyelination. Can you recover that patient by 70% in 2 or 3 months who have been treated 15 months in Manipal, 15 years in Manipal hospital? Now people start questioning me whether he is really recovered. I said, I'm going to bring EMG NCV machine by today. He said, new machine will come tomorrow. I don't know. You give me the demo machine. And today you are going to have what? EMG NCV machine, EEG machine. I've learned how to do brain mapping with the help of EEG machine. I just saw a video on the YouTube and I saw what the surgeon is thinking. I discussed with IP Cherian. Can we do brain mapping with the help of EEG machine? He says we can do it. Can we recover epilepsy? Can we recover with a CP child? Can we enlarge the size of the skull by subcutaneous needling? We can do all these things. So now you have to decide who is going to make a stroke clinic, paralysis clinic, and who does not want to make it. You see, you have forgot the difference. See, let us pick on your fundamental things first. Now practicals are going to start. Patients have come. They have been waiting there. I told them to wait for 1 or 2 hours. Because I recovered his trigeminal neuralgia in 1 needle. The family believes me what? The incarnation of God. If I say them to sit here for 6 hours, they will sit. I just wanted to show you a 5 years or 4 years suffering case I recovered with just dry needle, which needed a complicated surgery. It was a post-surgical case of a tumor. I forgot which tumors he had. And I recovered with what? 1 dry needle in 1 second, and I gave him guava to eat. Put 1 needle here. Yesterday you have seen with his father, na? Put 2 needles here and his spasticity is gone. Brain knows the language of signals. If you speak with proper language, then only you can become an expert. But if you speak in an improper language, you can never become an expert. Am I right or wrong, sir? Brain is his own way of understanding things. Right? You have a paralysis here or here. Where is paralysis? Where is paralysis? And where are you recovering? Who is the biggest fool of this country? Who is the biggest fool of this country? Paralysis and Parkinson is where? Here. But then you forgot the gut role of recovery in Parkinson's. I saw there is a huge scope not in ortho, huge scope in neuro-orthopedic cases. All demyelination cases. 75% of demyelinating neuropathy can be recovered. I read a paper of 1986. of electro-stimulation of nerves. He said, while doing NCV, I studied. But then I said, that physician, he used those needles on those nerves and he started stimulating those nerves with those needles. And after some time he found re-innervation of the nerve. That paper was not published, but then he published it. Where? In internet somewhere it was published. And I went through it. And I realized when you use dry needle as electroacupuncture, as brain stimulation, as simple dry procedure, your recovery is very fast. And we have examples and leading examples of the best hospitals of India who could not treat it, and I have recovered them 70%. Example is his brother. She had zero confidence on me when she came. They came for 15 days, almost 3 months. I said, you give me some more time. And I can see a good recovery so that he can go and marry. And now I see he's using this cycle. So first you decide who can spend 35 to 40,000 rupees to buy the pen. And those who cannot buy, it's better. Don't dishearten yourself. Learn dry needle procedure, pain management, prolotherapy, and be happy. My work is to teach you and not to think what you can practice and what you cannot practice. If your hand becomes expertized, you can join one hospital and you can practice. You can go to one hospital, show your cases, and you can practice. Why you need to register cases in your name? There are various ways you can find to recover a patient, but you must know the procedures. After studying all these things, what did I do? I am purchasing RTMS, and you will have to know this center will be one of the best neuro-ortho rehabilitation center in the world. Because we are going to buy RTMS, repeated transcranial magnetic stimulation. We are buying direct magnetic stimulation. हाँ? हाँ अभी ले रहा बस 2 minutes. We are buying MRI machine. We are buying CT scan machine. 16 slice. Not for our diagnostic purpose. Because if we divert, we won't be able to recover. We want for this what? For our own patients. And you will be presented today, first case with trigeminal neuralgia, bring one chair, and I'll show you in 1 second how I recovered it. I just took 1 second to recover what? Bring his daughter. And this is how I established my clinic in one room, in one unknown place, and I became a famous practitioner all over India. I started here, my practice, in one hotel room, which was totally empty. I left that hotel with full hotel. So this is the man. His case will be presented by his own daughter. The best part of my case is what do you know? Patient and doctors present their patient and the attendant presents their case. I don't present their case. Reports will give, I'll give it in the reception. They'll do the photocopies. They'll confirm that it was really a case of trigeminal neuralgia. We have evidence also, patient also, and we'll show you live also that he can eat guava. Get some guava or fruits. You tell them the history of this patient.
My father was actually operated for the schwannoma tumor in 2019 September. On account of the tumor, he is trigeminal now, and even the hearing he has lost to the right side. And since then he has been having instances of this pain. It's quite severe. Severe in such a fashion that even if there is a drop of water which goes this side, means since the operation his right side is not being used at all. He can't chew, he can't drink water, he can't even take medicine from that. So he used to eat from the left. Everything from the left, and small portions of
View
food.
from water, right?
Water also not even at
Before
room
coming
temperature. That was his condition, and we used to get this recurrence of pain suddenly. It used to last for 2-3 months. Even steroids were used, all sorts of interventions were done. Finally, last when we had come, before that also, one 3-week course of steroid was already used, but with no relief. And
For 2 weeks.
and for almost for the past 2.5 months, he is also not sleeping flat on the bed, because there is triggering the minute he
I
sleeps.
was only sleeping on
He was
the
sleeping
floor.
onto the left, and that also now only on seating posture. He could not even lie flat on the bed. That was the stage when we had come here. Even if you take medicine from this left, even a drop of water goes here also, the pain would last for
It
some
will
hours.
trigger
here.
like anything.
So that was the situation when we got him here. In fact, sir just detected the nerve which was causing the actual pain. Since that day, we thought probably winter, so it will maybe subside. But after that, now he is able to eat from both the sides. This is first from the center, to tell you very frankly. He is able to drink water. Normally, he is able to move around. There are instances of pain, but it's very mild, for say around 3-4 minutes, sometimes 10-15 minutes, when compared to the earlier situation.
Now, who wants to ask any question, you ask the patient. So that you don't think some placebo was done. Patient is here, attendant is here, his wife is great for osteoarthritis, is one of the best joint knee replacement surgeon. And today we are going to use his cocktail on your mother to revive.
Medicine cocktail, not that cocktail.
No, we have come to such a stage where, see, whatever be the means, if there is some reduction of suffering, that is enough. That is the situation we are in. In fact, my father was refusing to come here. He said, enough, I think I have to live with this pain. This is how it is, there is no point using interventions. Till the day we were getting him here, we never told him. It took almost half an hour for me to convince. I said, just one consultation. You are not convinced, let us not take the treatment. Just come once and go. We have seen so many doctors. Because my friend is a homeopathic doctor. She's been helping him with reduction in pain. I don't say her role is less, but she has given a lot of medication. Still, the pain, he used to be so careful, he would not even turn to the right. Throughout the day, he wouldn't talk. If he talks more, the pain starts. If he opens his mouth little more, the pain starts. So every instant he was so cautious, very clearly sitting like this, not turning here or there. If anybody calls him also, he wouldn't turn. He would simply turn this side, the pain will trigger. More than the pain, the fear got him so much that it might trigger and I might get pain. That fear was so high. I remember when we gave him water of room temperature, glass of water, his hand was trembling that day. I can't drink this, I'll get pain, is what he told. That was the condition in which we got him here. It's not less than 15 days, sir, but there's a lot of relief. At least he's talking normal, there's some more enthusiasm. That is how much I can...
For the first time, you can see him without a handkerchief or something on his mouth. He's talking to you.
So huge, he would stuff some towel and all, hold his head like this. The minute we see him like that, we understand. There were times he never used to tell us anything. He would just go sit in one corner, switch off the lights. So these points you would realize he's going through a lot of pain.
And I recovered him in how many seconds?
Hardly a minute.
earlier, immediately after operation, for 2.5 years before coming here also, Rigabentin and then
Still on Oxetol, Rigabentin.
and Leofenexin. These are the three medicines for this they were giving here on.
We used the course of MT16 also.
That was the
That also with
prescription.
last resort. We were scared of the steroid because he's diabetic. We know his condition.
what they said is still it doesn't come means
Only
now you will have
radiotherapy
to
was
go
the
for
option.
radiation. My goodness, radiation I know what it is. It's awful radiation. That is higher than this this type of this. But I wanted to avoid all other things.
And you can examine 2 cases immediately and our practical starts. First, we'll divide the batch into 2 parts. Those who cannot afford financially 30 to 40,000, 35 to 40,000, please don't go for an IBS. Without tools, without machinery, for example, C-arm. Without C-arm, how can I learn what he has done? The moment he said, I am coming, I started reading his profile. I said, bloody, he knows so many things. A teacher is coming to teach a student. The best respect I thought I can give him is, we purchased a C-arm in single day. Morning we called him, we spoke. We issued the check, and whole night, by 5 o'clock in the morning, C-arm is ready. At 4 o'clock, today at 4:30, you can use this C-arm. Because we don't have earthing, we are doing earthing, and 4 o'clock you can use C-arm. See, what you can practice, what you cannot practice, that is secondary. What you want to be, first you have to decide that. I wanted to be the best practitioner. I found lot of migraine comes from TMJ. I learned lot of things from Chandrakant, a very good maxillofacial surgeon. Very nice person who brought me to Hyderabad. He used to use alcohol, half cc to deficit the nerve. I said, if it is a trigger point, why not I deficit the nerve? Without deficiting the nerve, can I remove his trigger point? I took this case as an example and I am successful. I said, let them come for 1 or 2 months. What is the problem? Why should I deficit this nerve? Why should I remove this feeling? So what I used to do, to see whether the nerve is deficit or not, I used to insert a dry needle over here and then I used to touch his legs and I saw, oh.
My father would not let us touch him even here. That was how scared he is. If something, sometimes even his own
towel,
hand
if
triggers,
it's touched,
touches here, the trigger
then
will
it
start.
will flare up.
Very slowly, like a baby, he used to wash his face. That was the condition he was in. I remember sir pinching him, shaking his head fully.
Not only that, pulling his cheeks. Only to know whether I created a sensory deficit or not. Then I realized trigeminal neuralgia can be recovered without neurosurgery in 80% case is V2 and V3 nerve. Ophthalmic nerve, I do not know much. But V2 and V3, we can recover in 1 minute. So why don't we think of what? Creating centers and subcenters. Why don't we think of what? Growing together. Why don't we become one? Why should we divide ourselves? Why should you divide your knowledge, your expertise with my expertise? Let me use my expertise and bring it to a level. Let him go home and further follow-up will recover the patient. Why the patient has to stay here for 3 months? Why can't we make it stay here for 2 months? Because we are competent to do and recover the patient. After a certain level of recovery, again send it to me and send it to you. Within a year, spinal cord injury recovered, 100%. Now you see, What is my simple procedure? Joma! The needle which I use has no medical definition. It is 0.25 mm. Dry needle. Can you believe? One dry needle, 1 second of stimulation. Joma भेजो. Joma या जीनी जमा जो है. Can recover a trigeminal neuralgia? That also on the spot, on instant. I'll show you how. My theory is over. My slides are over. I only teach few things of wisdom. Rest, patience and practice will teach you. Those who want to really go in neurology, go in neurology. And go properly. Don't speak like a haphazard person. Just learn from Dr. Manavane. He left knee replacement surgery, a very cool, luxurious surgery, because he realized, I don't want to be Malia. Yeah, because tomorrow no knee replacements will be there. Orthopedic surgeons are struggling to get 1 or 2 knee replacements a month.
Yes.
But if you go non-conservatively, you have enough money at the end of the day, which is more than a earning of an orthopedic surgeon. Because you have created so much fear with Atal Bihari Vajpayee and other complications of knee replacement, that even his mother is having great for osteoarthritis, she said she will suffer from pain.
Even today is not willing to go for surgery. She knows she's almost on the dead end, but even today she's not.
You can see the X-ray and you can see the pain and you see how I recovered with only a combination of saline. But I exchange my knowledge with you if you teach me something about stem cells. See, I have learned one thing from Kaka Subbarao, who was the founder of NIMS. He taught me only one sentence. If you want to become expert, keep interacting with physicians through conferences and seminars and through social books. You will keep learning, and that is how I improved my knowledge. I keep interacting with dental surgeons. I kept interacting with physicians. He said it's a trigger point. It creates a permanent deficit with alcohol, but there is a chance you may damage the eyeball. Right? I don't know the names of the teeth, but I gave it 5 number 1. 1, 2, 3, 4, 5. Go inside, put the needle, rotate, take out. Trigeminal needle, and give him guava to eat. On the spot. Now tell me, patient will go to you or patient will come to me? Why?
You are curing them plus you are giving them guava to eat.
Yeah, right.
Double.
I gave him guava to eat. I recovered 2 patients of trigeminal neuralgia. One Avinash was saying, 15-year-old trigeminal neuralgia. She was on Tigratol, lithium, in just 4 sessions. Now she is enjoying her life. I said, wait for 1 month, then we'll take. I requested Avinash to send that patient. And second,
On the first day when we came, that moment my father was not having pain. He asked him to trigger the pain. He said, you get the pain now. Whatever you do, when you do something, how it triggers, you please trigger the pain. He was so scared, he said, then he sat next to me, he said, I am just sitting next to you. You trigger the pain and give me 5 seconds, I will remove the pain. We started giving him water, it wasn't that much. Then he ate a biscuit and it started coming. Later on, he was given a carrot after the prick. he could chew the carrot. So that's how it went. And that day he told us, he said, see, this is only diagnostic treatment that I made. I never said I've treated it fully. I wanted to check which is the major point which is triggering the pain. Why should we act on all the other nerves rather than act on the one which is causing the problem? So to diagnose this is what I have done. So you start coming from tomorrow onwards. That is how the journey began here.
We started with diagnosis and we found a treatment of the disease. I used this dye needle to deficit the nerve. Now I realized, without deficiting the nerve, trigeminal neuralgia can be cured, treated and recovered. Without any complication. This is the power of dental surgery. See, there are two things I tell you in life. I told this boy, I'm going to give you a book, which I have written day and night. I was really in mood because he's a very nice boy. When I was suffering from PTSD after the death of my mother, he took care of me like my own. I was thinking he was like my mother. At night 2 o'clock, 3 o'clock, he was so aware that I don't take what? No incident should happen. And if somewhere I'm come out so soon from PTSD, what's the role of these two boys, Vivek and Ganesh. They took 80% of the clinical load. They sold their clinic in Nepal. They used to earn 3-4 lakh rupees. Earning money 3-4 lakh rupees of a physiotherapist in Nepal is not a big issue. Enjoying a job here of 20,000 to learn. Their sacrifice made me so touched that I decided, what? We'll immediately have Siam. But one day he told me, I'm having a fear. Then I said, just go out from my room. I created a drama and I thrown him out of the room. Those who have fear, those who are insecure, they are not physicians. Two words should not be within your mind. Insecurity and fear. Those who really want to learn NIBS, they have to purchase the pen. You have no other option. Because if you buy RTMS, it is more than 21 lakh rupees. And
How to use the pen?
sir, 1 minute, he will teach you, Ganesh. I told this boy, every day there is a question in my room. Sir, हमको कुछ नहीं आता, हम कुछ नहीं सीखा है, कुछ नहीं आता, कुछ नहीं सीखा है. I said, okay. दूध का दूध और पानी का पानी हो जाता है. कितना दूध और कितना पानी. Let the physician, examiner test you how much you have learned. I will never be known for what I have done, but I will be always known by what my students have done. If I teach you brain stimulation and Parkinson and paralysis, it is the biggest what? Black day in my life. But if Ganesh teaches you and teaches you successfully, and he gives you marks, this is a real story I want. You cannot get so easily my signature in a certificate. I am Mk Sastri. People used to call me Hitler because if you give me examination paper, out of 250, 250 fail. I just ask one question. Is it a long case or short case? Long case. How long case? This is what you diagnose. First line of treatment, out. What is the second line of treatment? This second line of treatment in this is out. Lastly, the HOD used to take to me room coolly. Sir, all are failed. It is a private medical college, sir. What to do? I put 0, 0, 0. You put 7, 8 to all the people and pass them. And that is why, when knowledge was started purchasing in the market, the value of education has gone down. You purchased knowledge, right, from medical college by buying money, not by your merits. And that is why corruption and politics started in this medical science. Corruption and politics started because of what? Buying high-end equipments to do high-end surgeries, which could be resolved in a small matter. In his immediate second brain surgery, and I resolved it with what? One dry needle. And practical, you will see. Where was the pain? No, you sit down.
So which is the point where we insert this needle?
No, I will show you. Practical. Guava also practical. Guava is there. You will see everything practically, no hide and seek. But you will teach me stem cells.
Yes, yes.
अब पढ़ाएगा तो पढ़ाएगा, नहीं तो रामायण बना के
पक्का
हमेशा रामायण पढ़ाएगा, सब भूल जाएगा.
Madam, spirit
You are
sir.
orthopedic, I am from neuro. Why don't we make ortho neuro?
Yes.
Right?
Oh, yes. It will be a deadly combination.
All the patients of neuro are ortho. All the patients of ortho are neuro. You understood?
Yes.
Without you, I cannot exist. Without me, you cannot exist. So why don't we get married to each other?
Yes.
Today we are here for
In the
2
morning,
minutes.
just while brushing, just 1 minute stayed.
So there are 3 nerves. What are the 3 nerves? See just keep 5 minutes lecture on trigeminal neuralgia. He's a professor of what? Dentistry. Teach them trigeminal neuralgia in 5 minutes.
It's the fifth nerve,
5th cranial nerve.
which supplies the face, okay, and it supplies the muscles of the
Cheek.
cheek, yes, masseter. It also supplies the part of the buccinator, and it is a motor nerve, whereas facial nerve is a sensory nerve which carries all the sensation. So triggering point for trigeminal nerve happens in 3 ways. One is local, where very close to the oral cavity. Another one is central. If it is local, the point of treatment will be insertion of alcohol and trying to destroy the part of that segment of the nerve which supplies the oral cavity. If the trigger point is in the brain, then you have to do gamma radiations there so that the entire nerve gets deteriorated.
But this was a case of trigeminal neuralgia,
In the local
brain.
okay.
Because it's a post-operative case of
Schwannoma.
sonoma surgery, right? Because of post-operative surgery, which is a brain tumor. During the tumor, the artery compressed the nerve, cranial nerve 5, and it has suffered from what? Trigeminal neuralgia, right?
They will be keeping gel for some time, 1 or 2 months, and then again it starts. At the time of what you call the major operation, just they used to keep some gel and you press them. Later on, again it started like anything. They said that will not go earlier as it time comes slowly. It will have to go this, but that is almost 2.5 years. It is over.
Actually, sir, this
3
trigeminal
years.
neuralgia, we don't have any particular treatment. It's either to remove that, destroy that part of the nerve which is supplying it, or use a gamma radiation. But gamma radiation has to be done frequently. You can do it extra cranially also with they have a helmet which is being designed for that.
Or there is another treatment. You go neurosurgically, do a bare hole, and put a cushion
Cushion, okay.
between the artery and the
No.
nerve. Which neurosurgeon does.
But
But-
most of the patients don't opt for neurological.
Yeah, because post-op complications are always there. I found a simple way. It's a trigger point and recover it, trigger it. So what did I do? I don't know much about this drug.
I'll do.
I don't even know which is a molar teeth, colar teeth. I just count them. 1, 2, 3, 4, 5.
Fifth is premolar.
Fifth molar. So I don't know much. I make things what? Simple for myself. I know how to invest. I invested 7 lakh rupees on this last night. No, 20 lakh rupees on what? Siemens. In 1 minute. I will think how to pay the return on money. My chartered accountant say, it is not your work. We'll see what to do. First buy the machine. We should not lose a case because we don't have an infrastructure. We have to create an infrastructure. We have to work and then hand over to the competent people. Again go somewhere else, like IP Cherian, and establish a new center. I tell you, by next year, the 200 bedded, everything established, patient starts coming. On one night, you find my room is, I'm not there. And I don't go out with what? Bag and baggage. On mobile phone, and one ID card. And from the Facebook you will know. In the video of the recovery of the second patient of that place, that I left Hyderabad forever. People of Assam came to know. I left Hyderabad from the video of immediately I landed from the airport. I touched a patient. And I recovered one ETV is there. It's CEO production. His mother, I said, I will recover it in seconds. The CEO was stopwatch and she will be able to walk. She was bedridden. Immediately I telecasted the video. From that 3 patients came. Right? And my journey
Started.
started. Indragan gave me a lot of help. So, but you don't need to do anything. How I count?
మేడం హోల్డ్ దిస్ ని ఇది ముందు పెట్టి ఫోకస్ ఇది సార్ మొత్తం ఫుల్ రికార్డ్ ఉంది
Pull it like this. Yes. लाइट जला दो ना, तुम्हारे पास तो मोबाइल है. और 3 लाइट लगाओ तब जाके देखो. देखा? कैमरा, मैं कैमरा. Go like this. See, 1, 2, 3, 4. So we start counting from here. 1, 2, 3,
4, 5.
5, that is fifth.
fifth now. Go inside. Pull. Rotate once. Take out.
Okay.
Treatment over. Giving guava to eat.
You get apple also now. You go so much.
Go is much hard.
Guava, I always taste it with what?
Hard, sir.
Hard.
If you can eat guava, do litmus test. I am right or wrong. If I am wrong, I have no right to teach. Take back your money, take back your pocket money, and go home. And give all types of negative remarks about me in the Facebook. But if I am correct, learn and do in your clinic and have those people as this thing. Such a simple procedure that way. Man does not become complicated. Eat guava. From this side. How much pain? And I a good dental surgeon. Okay. You have to finish all the pores. Again you are eating from this side. This side. Eat. Why are you putting the camera? Where is the camera?
Yes, sir.
Ah, very good. Two more are left. You have to motivate these people that instead of creating so much complication with you, every person can recover trigeminal neuralgia in what? 1 minute. 1 second, 1 needle. Trigeminal neuralgia
Gone.
gone. You know how I learned all these techniques? Because I gave myself 34 years only in one room. In this place also, if you ask me, what is in the second floor, third floor, that also I don't know. I know only two places in this place. One reception, one this room, and one my room. That's all. I spent 12 hours sitting in this chair. Because I had a back pain, so I bought recliner. Who taught me to bring a recliner? Ramesh Baba. From there I learned that how can I sit 12 hours in a chair? Because after sitting 5 hours I used to have severe pain. Because I am suffering from CA, med spine. The night used to be horrible for me. So then what did I learn? Take sedative and sleep. Now I am taking anesthetic drug because of the severe pain. I realized one thing, I requested some of the people to allow me to come out from this disease. Then I realized my past. For 35 years, I lived an independent life. Right? And these people have denied helping me. Why should I ask them help? I lived 35 years independently.
Great, sir.
Why before my death I want to be a dependent person? I'll become independent again. But what did they lost? They lost a precious knowledge of me. Staying with me, they cannot understand what. It's just like Angulimal and this one. Buddha. Angulimal got moksha in 1 second. मैं तो स्थिर हूँ, तू कब स्थिर होगा? He understood and he was enlightened by the power of Buddha. The words of Buddha did not enlighten him. The powers of Buddha enlightened him. Because Buddha knew if I divert this negative energy to positive energy, what will happen? The patient will become what? He gave the whole world a mantra. What you know? Buddham. When he went to the village, people started pelting stones on him. Anju was observing for 3 minutes. Do the pain come after chewing so much? Let the dental surgeon certify. Let us wait for 4 minutes. Whether trigger comes or not.
So is there any directional needling?
Those things come well. When everything is proven. Now everything is not proven. Let the dental surgeon, the professor of dentistry, let us prove it that it has been, the pain is not there. So after chewing, whether the pain triggers or not, let us observe for 5 minutes. And in this, you must know, Angulimal gave the mantra, Buddham Saranam Gacchami, Dhammo Saranam Gacchami, and Sannam Saranam Gacchami. First, you must take the saran of sun, means you have to become united. This path of recovery is very difficult. The path of diagnosis is most complicated. Become
She will not sit. It's okay.
no.
Sit.
She will not sit.
She will not sit.
Okay, but you are playing.
Please.
Just a second
Over.
job. It's okay.
Now you see, this man who does not wanted to speak, today is enjoying his life. And after some time, he'll go back to marriages, social life, social interaction. He can talk to his relatives, playing cards. All that he can do. With what?
There's a last resort is only radiation. Until then, slowly you will have to. That's all.
Now can you believe? You can grow the skull of a person. Our CP child is a person delivery, right? A skull has been grown. Now if you touch the skull, you know it has been grown. She came to me both sides like this. Now you touch his skull. He's orthopedic surgeon. He's first year certified, sir.
Yes. Growing. Almost normal.
He's an orthopedic surgeon from Mumbai. Renowned orthopedic surgeon. Once upon a time, he used to do top 5 orthopedic surgeon means he 200, 300 knee replacements in a month. Understand? Now he gave up knee replacement like me. He became other sannyasi. He just realized with his disease what? And complications can be solved with easy method. Why to make it more
No
complicated?
complaint. Yes, yes.
Money, you have earned enough.
Perfect.
Mama, mama,
I'm going to put this sentence on Facebook. When complications can be solved with. What do you
Simple
say?
procedures.
Why make it more complicated? Yes, yes.
Greatness is in its simplicity. Mahatma Gandhi is not known for his greatness, but because of his
Simplicity.
I am not known for anything else, but I am known for my different clothes.
mama na. Na, pekom na. Aito.
But tomorrow this is space here, na? One space. In 2 or 3 days, this space will be what?
Closed.
Closed. That means what? Our brain has started
Pekom na, ma.
development. Today
Na,
evening,
mama na.
you will see 2 cases.
Pekom.
One is, this is called what? Infantile spasm, you see.
Mama, mama, na, mama.
See. Can you believe? A zero activity girl.
Responding.
Huh?
Reacting.
Reacting?
Now reacting.
You forget reacting, you see.
Hyperacting.
Na, mama, na. Pekom na. Pekom.
When she came to me,
Oma.
I had a zero hope of recovery.
Oh,
Now you see.
na.
How to put the needle? It's 5 minutes job. But first, be clear which is coming. You understood? And then decide. You are on which side? This side of the road or this side of the road? Those who really want to open a clinic, then only learn brain mapping. Those who really don't want to learn, please don't create a drama after that. Last time I learned from Bengali boys. I wanted to teach them. I gave them all the maps and laws. Last year, they are telling a person who has practiced 35 years that this pain is sane and you can buy it in 500 rupees in the market. That means what? I am a cheater in the fraud. A person who wants 50 lakh rupees per month is cheating for 5,000 rupees. Even if they are paying me 25,000 rupees as fees, it's orthopedic case. They are paying me 90,000. I don't know. Where is the 25, 40,000? 45,000 for the room rent and 45 for the treatment. Now, madam, check and see whether the pain has come or not. Let the orthopedic surgeon give the comment. Both. We have two examiners. Orthopedic and dental. Both are professors.
Yeah.
Now, what is the comment of Dr. Orthopedic Surgeon? So, what is the status of his trigeminal neuralgia?
His status is totally. There's
So,
no
first
pain.
introduce yourself.
No
Sir.
pain, yes. I'm Dr. Mk Sastri from Mumbai. I'm orthopedic surgeon.
So,
I'm practicing since last 22 years. So now this patient has got no pain, absolutely zero pain.
and you know, with this, I developed a special interest. We have what? At least one weekly clinic.
Yes, yes.
in Hyderabad. And then once little bit of Hyderabad is settled, 1 week of his is here, 1 week of mine is with me.
Yes, sir.
And then we both will sit with whom? I sit here. We three will get integrated because we are going to have more than 100 bedded rehabilitation center in Malad. You see, she is so much crying, right? Now you see how I play with her. Oh.
హలో
Oh.
చెప్పండి ఎస్ కాల్ ఆఫ్టర్ 6 ఐ మీన్ మీటింగ్
See, now say you go my father. I guess you could not even.
You're totally mobile.
You ask her what was her precondition. Take that statement.
She was not doing anything. Cognitively, nothing was there. So now she understands many things.
Many, everything.
Too much improvement.
Yes.
Ah,
She showed me the video how he was scolding the child and then how she was behaving. That video you will show in the evening. Let us finish some OPDs. And a practical start. Rajimani, how much according to you, madam?
మేడం
What is your who are you? How can you certify?
Because after the needle,
No. What is your qualification? What is your designation?
sir,
And how can you certify? Are you a certifying authority?
yes, sir.
So tell yourself.
I'm Dr. Periodontist and implantologist by specialty.
And you are also a professor.
Professor. I'm professor. I'm into the practice since 18 years. So we see these cases and we do alcohol insertion in the local area to just
To deficit
deficit
nerve.
the nerve. And without that, because alcohol insertion has its own complications, so this is the first time I'm seeing that when a needle is inserted and the pain is absolutely got back to zero. It's really nice and it's something I have to learn.
No pain at all.
That's what I
It too is healed.
Pain is
Without
zero.
deficit.
And without post eating, without any trigger points.
See?
Yes, sir. That's what I checked. Because
Maximum that he used to do.
external stimulation. Anything. Just a splash of water, it triggers.
Can you do like this with Rajimani?
No, sir. Even if you just blow at their face, they can't stand.
Not at all.
One
I
wind
cannot
also
blow
they
in
can't
those
expose.
days.
They can't expose
Even if
themselves to the
I
wind
touch
also.
like this, my own hand will never out.
The wind exposure to face gets exposed to cold wind, it will start. So
Not only cold, madam, even a towel is there to put it.
no, sir. I'm just telling. Wind only is so delicate. The towel will definitely be a little.
What about the towel?
But even if towel is put
That's it,
here,
okay.
that used to flare like anything. From here, all three areas.
And he didn't have him twitching also. Trigeminal neuralgia will have a little twitching moment. It starts like this muscle gets pulled and the pain will be very, very, very severe.
Horrible. It's really horrible.
Now with one needle, 1 second, pain is totally gone. With guava eating.
Yes, sir.
If you are alone, you may yourself think to jump out of
Yeah, kill yourself. That will be the
And
severity
that
of
is
pain.
my experience I am telling since 3.5 years. That's what
Imagine how this pain has recovered. So we have his wife, is called very beautiful orthopedic case. Get the wax spray of his wife. She has come.
Indira,
And make his combination. And then Come on to the new senses. And I will teach you how to do decompression.
Go and sit there.
What? Typically, diet, I'll make you a diet expert. You make me orthopedic expert, I'll make you a diet expert. Just give me 2 minutes, right? Just come in. Go to my Go and sit in your chair.
అమ్మా నేను కూర్చోండి
Oh, what is that?
కూర్చోండి కూర్చోండి
His father gave me so much apprehension. What I will do, what I will not do, 100 of questions.
కూర్చోండి కూర్చోండి మోకాలు
Now what
చూపించండి
I do, you know, any autistic child come, I tell him, talk to his father. Now let him bear the same pain what I bear of answering the question. Let him understand.
మేడం మీ
The question which he asks has no answer. Recovery only has the answer.
Severe. Middle number. Totally fine.
And she is having S5, S1, S4, L5.
Yes. Doing multiple L23, L34, L51.
Since he has come, learn how to learn PIBD from an X-ray. Use all the diagnostic technique. Then at the last, when he teaches us everything, in the last moment I teach him. First, he is student. Out of Guru Dakshina, I'll give him some little knowledge which I want. First, let me make him my teacher. Right? So in return, I cannot give money for what he has given. Knowledge is not money. We have become what you know. We have started earning knowledge with money. So what did you become? Zero.
మేడం కేసు గురించి
I started my clinic with 2,000 rupees. And you see, my clinic is much better than yours. And we are going to 200 bedded by next year. Because by now, I'm purchasing all the diagnostic, MRI, CT, everything. So when I have to go there, only have to purchase what? Bed. And Mutti.
Yes.
Please make his combination. Joma. Now how much pain you have?
Much better.
Huh?
Stiffness is not there now.
So you please check it orthopedically and say how much pain you have.
I just use fixed like
Like this.
Just a second.
కాదు నేను
Remove this.
సార్
It's okay. Is pain over here?
నొప్పి ఉందమ్మా అక్కడ
Over here, medial aspect?
Yes. Normally I get pain.
Over here,
here
you
only.
have pain over here only.
Yes. Most of the
Now
time.
do you have pain now?
No, there no. It's not there.
Now only. Fine. Now do you have pain now?
No, sir.
Now?
No.
Now?
Did I examine her so much? I don't get time to examine the patient. And neither I get time to counsel the
But
patient.
surprisingly no pain, huh?
Pardon?
Little pain is there, surprisingly.
Only here I am getting. Only when you press it, I am getting the pain. Otherwise, I am not feeling
She
any.
has had
Try
almost
needling.
6 attempts.
And then it doesn't mean saline solution. Did I give her painkillers?
No.
No.
Steroids?
It's only 12 days I think I started
Ajay?
treatment. That's all.
No, I'm telling she is able to slightly make it flat.
Flat. Actually, it was, earlier it used to be like a curve when I
Never
like.
going down.
You couldn't straighten it, huh? Your foot you couldn't straighten.
Foot, this part I can't. Knee I can't. Knee, most of the time it will be bent like this when I sleep. This
It was a genuine welcome.
No, it is.
Now you said, how much genuine welcome is there, sir?
She has only mild fixed flexion, 5 to 10 degrees. And Genu valgus is, she has Genu varus
Genuine virus only.
inside. Around 10-15 degrees.
How much recovery can you see?
Recovery is quite good. Swelling has gone
Out
down.
of 10, how
pain
much
is gone.
recovery?
Around 7.
With
Impedance
multiple
very
slip
good.
disc.
Huh?
You came with multiple disc, slip disc.
with that
Oh,
also.
Bapre.
I'm not having any that
Back pain is
sciatica
gone?
pain also has gone actually.
Acha,
We didn't
great,
know
great.
I was not
sciatica
know,
pain was
not
until he
knowing
told
that
me.
I'm having sciatica.
That was our
Only
stage.
after the X-ray he told me that. Then, but there is a lot of. I'm not getting the pain also.
We were thinking the pain was on account of the
So
liver.
we'll
All
put
the
your
time I was
combination
under the
in this
impression that.
and we learn how to give a better treatment. make this. जो माँ सांप का बनाओ पेशेंट को ओटी टेबल पर सुलाओ.
Here, come. We treat for sciatica or we treat for knee now first?
Knee
only.
Knee only.
Knee.
Sciatica is gone.
I came for knee, then I came to know about this.
They were not knowing that sciatica is there.
We came to sciatic pain, sir. We thought it is pain on account
On
of
account of the knee, actually. I was not knowing this.
हमारा सिविल का छिक्का है man. Father does not need authentic charges recovery. I say to see the recovery of that child.
No steroid.
Among the crowd, he made his way,
saline
goes to his seat, waiting for his treatment
Sir.
without getting any trouble.
Dr. Sastri sir, we'll not use intacorlin. We'll use what you are using, saline, normal saline.
No.
Huh?
Whatever you want to use, you use.
Okay, okay.
Then only I will teach. First I will learn.
Giving injection, I used to feel the pain.
Who can teach me better than 22 years old?
Yes,
Better hold it.
And this also. Multimeter. And we do what we like normal saline.
You just hold the camera properly. You give this to these young boys. Charge is there.
It is there. 17% battery.
Oh, it is gone. Any other power banks we have? If you don't have, you have to put it on there. It is there. ये लगा दो. What did you mix it?
No, I'm mixing it all.
What are you mixing? What are you mixing? It's your own.
No, it's not my own. It is that prolonged ozone therapy.
Oh, it comes in follow.
Yeah. But prolonged I have modified. They are not using this. And they are not using, they are using multivitamin complex, but I am using multivitamin. Because it gives a better result. And this has given a very good result.
This is the best part of my practice. I get best physicians from the country by telecasting my videos. You also learn, I also learn. Huh? Everyone has to win the game. Everything has to be medically certified, right? Or I'm not here to waste your money or time. But this time it has to be very clear because last time there was a lot of politics. Those who really want to learn NIBS, they learn. Those who don't want to learn all this what I have taught them. And that is why I said Group A, Group B.
21.
Remember one thing. You are studying though there is ribbon which and you have this
See,
kind of
now, this, if you see on the X-ray, there is hardly any space on the medial aspect. So what we do is we go on the lateral aspect.
So the X-ray, once bring the
उठ के
X-ray.
बैठो अम्मा उठ के बैठो उठ के बैठो उठ के नीचे छोड़ो घुटना हाँ see there is no one minute
Where is the X-ray of the patient?
X-ray
X-ray.
madam I just Keep it straight, huh? Keep it straight.
She's complaining the medial side, you see?
See, medial side, na, there's no...
Not that
Oh, don't touch. There's no space. If you see the X-ray, na, there is no space for the needle to go inside. See, her medial aspect, na, you see, na, this is how we can put a needle away. Huh? We have to go from here only.
Yes, sir.
Lateral aspect. There's no way in which we can penetrate the medial. There is no medial space. So from if there is nothing, how are you going to go into inside the space there?
I'll teach you how to go there.
Yes. Where did I come here? Are you?
You cannot go with
Yes.
this, what you call? Your needle. My needle can go there.
Yeah. That is the magic of the treatment, Sir's treatment. That is why I'm here.
That's right.
You become a magician.
And that is why I'm sitting next to you.
Especially in my husband's rising.
See, one thumb below the lower pole patella and one thumb besides. You have to go inside. Okay? Slowly inject.
It should be very slow.
Very slow, huh? Very slow. And usually in my clinic we are giving this combination plus we are giving this also, ozone therapy, ozone injection for recovery, pure oxygen.
So it will recover?
Of
Because,
course.
no, because ozone,
Sister,
I thought,
ozone, see, your body, no? See, what is ozone? Ozone is pure oxygen. O3 plus O3 na, inside the body causes O2.
yeah, okay.
So it 100% recovers. See, whatever your body does, like Sir said, it requires oxygen. If there is no oxygen, no organ is going to survive.
Yes, sir.
And each and every organ, daily, in 1 month, it goes destruction process. What do you call as blastic activity?
Huh.
So like a bone has an osteoblast.
Yes, sir.
So it has to be replaced. So how, and see, what is arthritis? Arthritis is a wound inside a joint. So to heal a wound, we require oxygen. And plus now new technique what Sir is teaching, that dry needling.
Huh.
Plus this and ozone therapy is a deadly combination.
No. The combination which we make
Yeah.
in the...
How's the pain?
dextrose,
Pain is gone?
Pain is
It will take
there or not
around
there?
4, 5 or 10 minutes.
No.
for the recovery.
No, no, no.
No, as it is.
Now needling pain is there or not?
No, it's not.
No,
When
you
I
check.
was giving. No, sir.
No, you check. Present, see, needling pain is there or not? You
And
can
what
check.
usually what is said now?
See,
That
she is having a needling pain. You
Yeah.
can reduce the needling pain in 1 second. You know one needle.
how?
That's why I said, you teach me one, I'll teach you one.
Sir,
that is
it's
a-
already open.
See, that is the interest of what when two physicians meets.
Yes.
When two experienced physicians
And
meets.
what some people say now that they add 25% dextrose. Because dextrose is causing inflammation for the process to healing process to start.
But
It is like that.
inflammation is required now, sir, for healing process.
Yes, but now the new technique, what Sir is saying, that we inject sodium chloride.
Oh,
It is an anti-inflammatory.
My father.
So what we are doing now, we are mixing both.
okay.
Anti-inflammatory
combination.
and
And
inflammatory.
Okay.
No,
But
see,
inflammation, one no anti-inflammatory.
how did we learn? We used to give dextrose combination
Yes, sir.
to this patient means under block.
Yes.
Third day or fourth day, they used to come with severe
Severe
pain.
pain.
And then I asked, Papa, ये तो रोज का झमेला हो गया. The best part of me in Monsing is a master of what?
Pain relief.
Not pain management. Anesthesia.
Anesthesia.
In
Ah,
this,
yeah, he's not coming.
आएंगे वो 4 बजे.
Ah.
He's such a person, such a humble person. He never speaks anything. To take out one knowledge from him, he taught me epidural in just less than 30 seconds.
No.
That's it. He taught me once and I practiced that process. How many times you know? Every day I practice 200 times that process. Now I can do it with what? With closed eyes.
Close eyes.
How many days back he taught me? 7 days back. Only one episode. My hands are shivering while taking the spinal needle. I do my process now. I go paraspinally and I press and then I give that idea. I'm slightly skeptical because there may be a hematoma.
Yeah.
I've been always told to work with Siam. Without Siam is like my wife. CT and Siam is my wife. Without this, Mk Sastri don't exist. And I wanted to find a new Mk Sastri.
New way. Pure.
Until we innovate ourselves, you cannot find your real self. I wanted to prove the world there is a power called Kundalini Shakti, right? People did not believe me. I said, one thing will solve my many political situation. I may die also, I may not die also. But I must try to take that attempt. How much did I what? Yes. She knows, na? So what did I do? I took more than 500 milligram of IV and IM of diazepam and metazolam with 60 milligram of 40 milligram of calcium with bupivacaine of 30 ml directly.
With such a dose, an elephant will die.
Yeah, so.
And
So this is perfect.
8:30 I had a breakfast in chutneys. 9:30 I am doing a test. 10:30 a video is telecasted. But I think great. One thing was saying, you have to give him antidote. He was sitting next to me. They were thinking.
No, my brother told me that there are so many sisters and doctors around. I think there's some complications.
And I decided to do it 3 o'clock. I thought all the world is sleeping. I never thought foreigners are awake and they will make everyone awake.
So they contacted Facebook. They will contact
I wrote gratitude to all the people. I thought I will die. Who thought I will live? See, if you are a physician, sometimes you must take deadly experiments. दूध का दूध और पानी का पानी सामने आना चाहिए. You put this needle here. Is that patella? Put your finger one. And
Lower
Yeah,
border.
about 900, huh? This is a patella.
The lower border, sir.
the lower border, the middle border.
Middle border. About 1 finger above.
Put your finger here. Hand it. Put the needle. Rotate 1, 2, 3. Now check your needle.
Hair gone? Huh?
Yeah.
But this procedure can be used for arthritis also?
You put any in there because during this I have taken so much during dengue and all. I have taken so much intravenous. Right?
Pain is gone?
No, sir, it's not there.
It's not there?
Pain is not there. Earlier I had. No, it's not.
Take it. Amma, take it.
Lower border.
Okay, just push it in which direction, sir?
What nothing to go for any direction. Needle, rotate, take, finish.
So where are you? Lower border.
So how to locate the part of the patella?
That he will teach you in the evening.
I teach you.
We have 2 professors, don't worry. If one makes a mistake, 3, not 1. This time you will learn from 3 professors. How to recover migraine from a maxillofacial surgeon? A type of maxillofacial only.
Sir, periodontal implantologist deal with bone and part of bone and gums and implants.
So, you know everything about TMJ. So, how to recover TMJ?
TMJ pains can't be recovered.
Only one needle is there.
Finish. Topic over. Go. Walk and check. You check your diagnosis. Clinically you test.
చాలా అయిపోయింది కదా నాకు కొంచెం నాకు ఆయిల్ కానీ పెయిన్ నాకు
No. Let us test clinically.
No pain.
నో పెయిన్ సార్
See, his father was also gone. See. Great, huh? Next week you should be running in Hyderabad marathon. Huh?
Well, make her play football.
especially when trigeminal pain is and that purpose surgery became possible.
But then that this became secondary. But then I saw her X-ray. I said, We needed money for this CM and all. So I said, I cannot charge with this father because one needed procedure, what I will charge. But then I got a great osteoarthritis. I wanted money for CM immediately. I said, can you give me 25,000? He said, yes. Ready. Sit down.
Only one is both is.
This is also
Now you walk and see how much pain.
pain is not necessarily normal, of course, because of this.
Now we check. Now see a normal walk.
Yes, yes.
Now see the gait pattern of the person. Hey, physio, check the gait pattern. Madam, you walk outside and see. Acha, can you tell me, large capsulogangular bleed, craniotomy with tracheostomy, can a person sing a song better than you?
No.
Huh? Possible? I'll just put the name. It's okay, let him come. I'm very happy. He's very excited about needling. How much pain? Then who will go for a knee replacement? Your father. So what I am doing, I am changing the morphology of the brain, and one day I will use my Kundalini Shakti. When Karchal or anyone comes, my student, I will recover by 50%. I use my internal power also, I use my knowledge also. How much pain? This pain? How much you recovered? No. Where is the 30% pain?
Pain is not this, sir. Sometimes not when I get up.
Because of the spine. Tomorrow you come, the spine problem also will.
Now one hour we sit, now 1 hour we will give a second.
Let us do a second tomorrow. You came with one, you found one of the best knee replacement surgeon, recovered without study report, free. This is the benefit of Mk Sastri Hydrabad. But then you have been treated by the best knee replacement surgeon of Maharashtra.
So that's what I'm telling. The minute anybody talks surgery, she will be back home. She
But
wouldn't
you
stay
see
here.
how easily recovered.
Yeah?
And it is amazing.
Really magic for us, especially with respect to my parents. That I cannot deny.
See, this dry needle has no medical definition, right? But if you use it carefully and properly, before you ask the patient, how is your pain? The pain is gone. First is the confidence of the patient. Then is the treatment. Third is the procedure. Fourth is the reasons of the pain. Pain has 24 reasons. We solved 3. Others are left.
This solution only we have. We don't know the other reasons. We only think the pain is on account of X. The pain is there, even the X is there, it's okay for us.
You only know pain with X-ray. I know pain with what? Brain, with the pathway of the brain. How to create a pathway inside the brain so that regular endorphin is released, corticosteroids from the brain are regularly released. And see, the moment she has the pain, after 10 minutes the pain will go on. Same thing I did. I inserted first these few needles over here. I created a pathway inside the brain. Now, he has a regular dose of endorphin and corticosteroids from his brain. I created the pathway, na. So the moment he says, I have a pain, after 5 minutes, how the pain goes away? Because the brain is releasing endorphin and cortico by himself. Do you need anything else? Nothing. Brain himself is doing. Why you need to do? You taught me one technique, I taught you one technique. आपका नीडल का जो पेन था वो तो खत्म हो गया. Knee pain can go away. I'll teach you how to go away with the elbow.
So you teach me, sir. I have it.
Madam, I will teach everything. What I will do with this knowledge? My knowledge is already good for nothing. Right? My knowledge only made my family, me, an orphan. So I decided, this is so poison, better to give it away. Yes. When I started giving away my knowledge, openly on Facebook, made them recordings, right? Because the lights come in my eyes. I think nothing. I only think that when I can teach an accountant and my, you know who are my OT assistants? My drivers. For 34 years, I never taught any people. I used to take only one seminar. And that seminar also, 35 people used to come. Only 3 used to remain on the last day. Today I used to teach 3 Christian. Because it did not come with determination of learning and practicing. You just came here for what? Learn with pre-assumed ideas. Do not continue your journey. You just came here to walk 3 steps and you stop. So you became what? 0. You know, there is a person called Kaka Subbarao, the founder of NIMS and Medwin Hospital. When he was in Medwin, Medwin was the best hospital of what? India. He was the creator of NIMS, Indian Institute of Medical Science. He had only one formula, create every month conference and seminar. And that is to identify young talent and is to tell them, let them meridian, give them home and make them practice it. You must find out, if I don't take seminar, how will I find Manvarne? How will I find you? How will I find your techniques of learning? You have a lot of experience in nutrition. Everyone is experienced. Just exchange our experience. You taught me one combination, I'll teach you another combination. Better combination. You use steroids, I'll teach you without. I'll teach you homeopathic dose of medicine can recover. Why to use this medicine? Both are required. But according to me, putting steroid is a. I don't like that. But when a homeopathic dose is called not PNIT, I teach you PNIT. How to recover sciatica pain? What is a pain? In 1 minute, I'll teach you. But in return, you teach me something better. That is why he said, how much fees I have to pay? Fees? So you are my full free guest forever in my life. Why? I am made to take money from my teacher, I have to pay him. This is how you have to understand to find talent. I went to his Facebook, I followed each of his posts, and in each expression, I studied his facial expression. Every course what he attended, I followed his facial expression very closely. How much is he satisfied and what is he looking for? Because we are teaching in orthopedics at 25 years, he may create panic here. He may immediately certify this is an unauthentic practice. All the seminar students will go away. You may spoil my seminar. Bringing him is the most riskiest thing I have taken in my life. Because I was with 2,500 orthopedic surgeons, right? Working with orthopedic surgeons, they know only one thing, carpentry. They never work with one, recovery of the patient.
Artistry.
I call it carpentry.
Right. Carpentry or artistry.
Ah.
This is artistry. That is carpentry.
No orthopedic surgeon does artistry.
Artistry.
They only know what? Fractures, 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 and
Fix
fractures.
only the fracture fractures.
They never knew how to recover a patient. Now you see how I change the morphology of a autistic child after 6-7 months. This boy
Normal.
will go to school. His activity will become what? Already it is reduced by 25%. I saw his first day behavior and today's behavior. How much change? You see a single person with dry needle with multiple complications. And not only teach, proves by examiners. Professors are here. 2 professors are here. Let them give marks whether I am fail or pass. Physiotherapist should say whether I am really good or bad. Give me needles. That is why I work with multi-speciality. Ayurvedic doctor test me with Ayurvedic knowledge. I started Ayurvedic knowledge learning at the age when I was a student of class 3 or 4 from my uncle. He taught me how to purify king cobra poison and bring a patient out of coma. And I used it on my mother. 2 times I brought my mother out of coma. And lastly when she is suffering, I could not bear. Finally I gave up.
చూపిస్తాను
2, 3, no, now 3.
వన్ ఫినిష్డ్ వెర్షన్
Now 4. Now coming 5. 6, 7. And then go home.
This is which pathways you use? Spinal cord?
No, no. I'll teach you some arts of brain mapping. First let us complete the patients. Because these patients are waiting outside. So finish some OPDs, IPDs. We have enough time up to night 2 o'clock, sir.
Have you ever done Jagrata? Now it will be Jagrata for Jagran. Mata ka Jagrata and Jagran.
This is why people say me when I wear this dress, Mata ka Jagrata hai. You see how it mixes with. How much hyperactivity is now? Do you see any hyperactivity? Now I'll show you another magic of dry needling. I'll bring you, represent you a singer, President large tracheostomy, coma, who came to me in class coma scale 3. Sir, how much chances are there of a survival of a patient in class coma 3? Discharge from ICU? Huh?
Hardly anything.
Hardly anything, na? Can you think him singing better than you? If I show you this, will you teach me the best methods of stem cells?
Yes, yes.
Best methods of stem cells.
Yeah, yeah.
No hide and seek, sir.
No answer.
If you hide and seek, I'll make more complicated method than I'll show you. See, if you teach me complication, I'll make it more complicated. Right? If you teach me simplification,
You simplify it.
why I called you? Because people have lot of migraines just because of TMJ. Yeah. That's what we have to learn.
So what TMJ is the same treatment? Same?
No.
Then?
First let us learn the pathology, then we learn how to treat the migraines. 85 types of headache can be treated only with dry needle and TMJ pathology. You must know what kind of pathology they are having. And TMJ migraine can be treated even in 1 second, like this. By pricking 2 needles. Then 95% more in 1 minute. No painkillers required.
So even myofunctional pain syndrome.
We'll discuss with each pathology. We have enough time. You want to learn more? Cancel your ticket. If you don't want to learn more, no extra charges. If the rooms are available, you stay as long as you want. I'm not a greedy man. Neither was I. Because of my lack of greediness, I have become what? Top most pain specialist of this country. Because you recover with so many things. I recovered with only one needle, dry needle, 0.25 ml, which has no medical.
Definitely.
Bring that case. नहीं वो मेरा सिंगर आपका भी मिलेगा. And now you will finish this and take new video. People don't have patience to sit 2 hours.